Hey, it's Chris Byer.
Chris Bowling.
Hey, CB, we're back for week number 2.
Woo.
Talking about the large, or I guess mega employer survey that we received from a client, the results from the business group on health this fall. And we talked about the first 4 last week, things that the large employers are concerned about. And I think this makes sense for anyone that's self-funded to continue to keep these on their radar as they go into 24 and beyond. So we'll kick it off with number 5 on the survey. It says employers are looking for transparency to contain costs and improve quality. I know that's another topic that we have been focused on for quite some time, but it's not just finding out how much stuff costs. I think it's also making sure that members know how to find access to those things that are better costs and outcomes. That was number 1. It wasn't just, we need transparency. It was transparency exists. How do we guide somebody to that right option?
It's the biggest, as you know, we created a network in the Quad Cities that's now expanded way outside of the Quad Cities. But yeah, number 1 problem is Mr. and Mrs. Employee, will you please consider this special network that we bolted onto your current plan, so we didn't take it away. And it's just, I go back to, you've been programmed from the day you got insurance. You have an insurance card. I call it a unlimited Visa card. And you just go where you go, right? I mean, you might ask a friend, and yeah, we have to continue to evolve this on how do we make it easier for that employee to determine, where should I go if my back hurts, my knee hurts, I need a colonoscopy, I need a mammogram, whatever that is, especially elective, because elective, you have time, right? If it's something emergent, yes, go to the ER, and you know what, where you get your care is where you get your care, but maybe your follow-up care once again can be addressed. Yeah, transparency is going to be huge. It also talked about PBM transparency. So
where the money's going and who makes it.
That's right. Yeah, when I talk to my pharmacist and they tell me my 90-day of atorvastatin, the ingredient cost was something like 38 cents, but I see it come through on my EOB as $250.
Yeah.
That is a non-transparent transaction.
Very much so. Yeah.
Who got paid? Because it wasn't my pharmacist,
Right. And you think of, if this is a mega employer, how much money they're spending on their health plan, and every dollar is going to matter. This is key for all employers, but you just think of the millions of dollars that are being wasted because people don't understand where the money goes or what it costs or how to access it. So number 6, what did we have there, CB?
Something we talked about on Bottom Line Thursday with Brad Johnson, and the big mega employers also experienced about a 6% increase in going into 2024. So we kind of discussed this. We're still seeing healthcare costs rise. We've been talking about pharmacy costs, but they are focused on how do we improve outcomes, right? So we know costs are going up, but we can't control that as much as we can control where are you going for your care. And is that the place to get the best outcome? So we don't have to repeat that cost twice.
Yeah, we just had an employee meeting where somebody said, what questions can I ask my doctor? Because I'm in there with my doctor and I'm nervous about it. A lot of it revolved around just what's necessary and what are you doing just because you think you want to cover all bases. And that is so common. I had that happen with my wellness physical. They did my blood work and they scanned for everything, not just the wellness profile. So I get a bill in the mail and I was like, wait a second, how do we do this? Oh, we just went ahead and did so. My fault for not asking, but you just don't think about it when you're there for your wellness visit. So you multiply that by thousands and thousands of employees. It's a key component. Number 7.
You got this because you're the one that, this has been something you have really focused on probably the last 3 to 4 years is what?
It's on-site clinics. And the survey said that the mega employers have offered them, about half of them do, and they're not really adding more. But I'm starting to see the smaller employers look at that. And it's not so much that it needs to be necessarily on-site, because I think we get some pushback that I don't want to have to go see my employer's doctor, but some form of direct relationship, direct primary care site where, maybe a physician on site from time to time, so that we can control most of the day-to-day concerns and then direct care the right way. And I think providing that service to the employees and to their families is going to continue to grow. And we're starting to see that those clinics or physicians that we're looking at them can now also have some pharmaceuticals on site or on hand. So you
Oh,
can
cool.
again radically reduce the cost of your care, because that's going to be billed to the employer. We're going to be around, or I guess around the employer costs. It's not going to be through the PBM at that point in time.
There's, you know, probably 100 companies doing this. You and I have
Yeah.
probably dug really into about 3 to 4, and
Yeah.
I'm excited where this could go, because I think this is the future of healthcare. Is,
Yeah.
you know, how do we steer that employee to a more cost efficient model? But more
Yes.
importantly, how do we get that employee out of a big health system that then everything's referred into the health system and the
Yeah.
cost is 10 times more than it should be? And
Right.
you know, sometimes you need to be in that health system. But when I look at a
Yeah.
colonoscopy and it's $6,000 versus 1,200, because you want me to go to one of your doctors because they're employed by the same employer you're employed by, that's
Yeah.
garbage. So
Yeah. And I think that on-site relationship, the primary care relationship, helps that employee navigate. We say that's where your journey starts, with your primary care doctor. And I think an employer providing that ecosystem to help them start in and then refer on is going to continue to improve our smaller employers that are self-funded.
large employer, you and I work with, every employee meeting, I would say, please raise your hand if you've seen a doctor in the last 2 years. And I bet less than 4% were raising their hands. And then I go
It's
directly
scary.
I'm like, folks, you have 100% benefit as long as you don't get a blood test outside of the norm.
Yeah, yeah, true, true.
At
And
least
so many of these employers too are offering worksite benefits where you get a wellness benefit for having that done. So now you're getting paid to do something that's free, and it's a challenge of getting it scheduled. So
yeah,
I think this ties into number 8 too, because
totally.
not only are we looking at on-site clinics, but employers are really starting to expect more from virtual healthcare, not just I need to see my doctor because I've
Right.
got a cold, but how they see that care will be delivered in the future. So one of the organizations we looked at for on-site clinic is not it's very cost effective because you're not having to build a building, you're not having to bring a doctor on site. They are truly using a 10 by 10 room, and everything is interconnected with technology, and then you're remoting in with that local person in with the doctor, so that doctor can see patients all over the country at all different sites, and it's allowing them to truly do the scans and everything that you would normally do in a visit without having to have a physical doctor employed for that location. It's pretty cool to see.
Yeah, I would love to know through COVID how many Z packs were ordered that probably did
Yes.
not need it, right? Because it was, yep, I've got this, great. You know what? We're gonna get a Z pack ordered for you.
Yeah.
And, you know, I know for a fact that we are abusing antibiotics, but at the
Yeah.
same
Oh,
point, I am a huge fan of this because 9 out of 10 people kind of know their body. 9 out of 10
yeah.
people know what's wrong with them.
Yep.
And you know what? To reduce costs, make it a lot more efficient. I mean, think about having to take off work, especially
Yeah.
kids. I mean, you were telling me this that, man, virtual visits was a game changer.
Yeah.
Of not having to
Yeah.
take off work, go get your kid, bring them to the
Yeah.
doc. It's just,
Sit in the waiting room when they're not feeling well. It definitely helps. And I think also with virtual care, the other challenge that we've noticed is people are starting to use it for that cold or flu, but that doesn't get back to their primary care doc. So you're not able to, I guess, relay that information. That needs to start happening more, so where that virtual visit is somehow communicated with your doctor, because they don't have the records. It's a siloed care situation, which we want to try to
oh,
avoid.
love it.
So number 9,
Yeah.
employers are really focusing on health equity. So
Yeah.
ways to address different populations, different family needs. A lot of that's coming through fertility and family forming benefits. I'm trying to figure out what fits well for the demographics in my company to make sure that our employees have access to the healthcare that they need, the healthcare that their family needs, and that fits for their specific needs. I think that area is really starting to come through as you look at diversity, equity, inclusion, as those I guess the words are there, but now we're finally starting to see how that care can be adjusted
Yeah.
and delivered correctly. We met with a provider of fertility benefits this summer, just had a conversation about all the ways that these large employers are finding ways to help that family afford the cost of going through fertility treatment or adoption or things that maybe were thought of before, but they weren't a family benefit that was
Yeah.
made from the employer. And I think that's starting to change in 24.
100%. This was
CB,
fun.
I think these were good ones. Again, 5 through 9 today, as we focused on the business group on health survey on what mega employers are thinking at for 2024. Appreciate being on with you.
Good way to kick off the year.
Absolutely. Thanks, CB.
All right. Thanks, buddy.